I'm going to explain the correct technique for probing. For adaptation, you want to make sure that the side of the probe is kept in contact with the tooth surface. For angulation of the probe, you want to make sure that you follow the anatomy of the tooth, maintain contact with tooth surface, and touch the junctional epithelium gently. It is important to make sure that you're parallel to the long axis of the tooth to achieve a true reading. So you want to remember to walk the probe, and probing under the contact will be 20 degrees under the contact. And what you're doing is, when you're walking, you're feeling for the soft rubber band resistance of the junctional epithelium, and it may be different based on the severity of the diseased junctional epithelium. You want to start at the distal line angle, and then for the touch contact, you want to make sure you angle to the coal and then keep the probe as parallel as possible to the long axis of the tooth. And for direct surface, you want to walk along direct surface to the mesial and interproximal. Right now I'm going to demonstrate the correct technique for the 11-12 Explorer. First, you want to select the correct working end, and to determine the correct working end, you want to make sure the tip is at 90 degrees angled to the lower shank, and only the terminal 2 millimeters of the side tip is adapted to the tooth surface. After selecting the correct working end, you want to insert to the base of the pocket. Make assessment strokes across facial surface, and then you want to roll the instrument handle to move the tip around the mesiofacial line angle. Then you want to assess at least halfway across the mesial surface from the facial aspect, and after that, you want to select the correct working end and assess the other half of the tooth. You're going to explore all surfaces towards you and do the same for surfaces away. So for anterior surfaces towards, it will be at 8 o'clock, and anterior surfaces away will be at 11 o'clock. So the correct working end, to determine the correct working end, you want to make sure that the working end curves towards inward. You want to make sure that the working end curves inwards towards the facial surface, and it wraps around the facial surface. And then you want to make sure that you rest the handle between the third knuckle and the V of the hand, and this will maintain a neutral wrist position. The lower shank should be parallel to the surface, being instrumented or explored. And then you want to do exploratory strokes, and there's tactile sensitivity here. And exploring is used at the initial assessment of subgingival calculus detection, at the reevaluation, at the completion of removal procedures, and the strokes should be short in length, overlapping, so that includes horizontal, vertical, and oblique strokes. You want to make sure you have a modified pen grasp, so that means that the thumb and the index finger gently grasp the handle, and the middle finger rests on the shank. The ring finger is the fulcrum, and it will stabilize the instrument in the mouth. So for adaptation, you want to make sure that the middle finger, thumb, and index finger forms a tripod effect to provide stability and control. The fulcrum will be on within 2 teeth of the tooth that you are exploring, and for the visual cue, the lower shank is parallel to the long axis of the tooth. For the strokes, you want to make sure to keep the thumb and index finger separated in order to roll the instrument. You will need to roll the instrument to keep the working end adapted. So your middle and ring finger should always remain together for support. So they're married, and you want to, and this will force you to wrist activate to reduce any injuries. For wrist activation, you want to make sure you want to think of the parade wave, or like turning a doorknob. It will create less repetitive stress injuries when you use it in combination with the wrist and finger activation. And for maxillary, you want to use the fingers to activate your instrument, and your palm will be facing up. For neutral position of the wrist and fingers, the wrist is aligned with the long axis of the arm, and the little finger side of the palm is rotated slightly downwards, and the fingers held in a rounded shape and light pressure against the handle. For the hand pivot, you want to make sure that for the hand pivot, it will allow you to adapt the working end as the instrument moves around the tooth, and it's used on the line angles and onto the proximal surfaces. For the handle roll, you want to turn the instrument between the thumbs and the index finger to readapt the instrument. This will enable you to move along the tooth surface without altering the fulcrum. The index and thumb is always opposite during instrumentation, and you want to maintain a light grasp so that you can feel the vibrations in the shank. Explore all of the teeth, and then you want to evaluate the extent of the deposit. So this will assist you in classifying, and then as well as aid you in the treatment planning. And then the light grasp will help you have the tactile sensitivity, and that way you can detect any surface irregularities, and the vibrations will travel from the shank to your fingertips. Large deposits will slide over the. For large deposits, you will need to slide over the deposit to reach the base of the pocket, and you want to look out for the buccal maxillary molars, lingual lower anteriors, interproximal surfaces, all atomical concavities. And for posterior, the correct working end, you want to select the correct working end for the area that you're exploring. So you want to observe the relationship of the lower shank to the distal surface of the premolar tooth. So you want to use the premolar tooth for selection because this tooth you can easily see. The lower shank is parallel to the distal surface, and the functional shank goes up and over the tooth. And for the correct working end, you want to, for selecting the correct working end for the posterior teeth, just think functional shank up and over, and for posterior, parallel. For assessment strokes, for vertical strokes, you want to activate, it's activated parallel to the long axis of the tooth, and for oblique strokes, it's diagonal to the long axis of the root. You want to start at the distal facial line, and you work back towards the distal surface. So first you want to place the explorer tip in the get ready zone, then you want to lower the instrument handle, gently insert beneath the gingival margin, make feather-like strokes towards the distal surface, and then vertical strokes up and down. As you approach the distal surface, you want to roll the instrument handle slightly to maintain adaptation. Explore at least halfway across the distal surface. When you're ready to explore the mesial and the facial and mesial surface of the tooth, you want to begin at the distal facial line angle, and then position the tip in the middle third of the crown, and then you want to lower the instrument handle, gently insert beneath the gingival margin, and make a series of feather-like strokes across the facial surface. Oblique strokes, which are like the diagonal strokes, and you want to roll the instrument handle as you approach the mesiofacial line angle to maintain adaptation. Vertical strokes on mesial surfaces, and you explore at least halfway across, so 51% of the mesial surface from the facial aspect. For maxillary left lingual aspect, you want to position the tip at the distal lingual line angle, assess the distal surface of the midline, assess the distal surface to the midline, make sure you have vertical strokes, and then you want to reposition the tip at the distal lingual line angle, assess lingual surfaces with feather-like strokes, and then use oblique strokes. And then you want to roll the instrument handle to keep the tip adapted around the mesial lingual line angle and use vertical strokes. And you want to assess at least halfway across the mesial surface. Right now I'm demonstrating the incorrect technique for probing on tooth number 3. You can see that I'm only taking measurements at 3 sites on the buccal surfaces, as well as 3 sites for the lingual surface. My probe is barely going underneath the gum. It's important to make sure that for my adaptation that the side of the probe is kept in contact with the tooth surface, and to make sure that the angulation of the probe follows the anatomy of the tooth, and to maintain contact with the tooth surface. I am not touching the junctional epithelium gently. I'm barely going into the gums. And for exploring, I didn't go subgingival. I only explored the supra surfaces, which is the purpose of the explorer is to detect calculus underneath the subgingivally.